Good morning. Can everybody hear me okay? My name is Wayne Osten. I am the Senior Vice President for NewYork-Presbyterian Hospital and the Director of the NewYork-Presbyterian Healthcare System. And it's my honor and privilege to welcome you all here this morning to our symposium on the future implications, policy, clinical directions with respect to nephrology. Just a word of background, the New York Presbyterian Healthcare System is an organization made up of 29 acute care hospitals, nursing homes, specialty programs in the greater New York metropolitan region. We also include members in New Jersey and Connecticut as well. We are very proud that the Rogosin Institute is a member of our system and a close member of the New York Presbyterian family. So we're very pleased to be working with Rogosin in sponsoring today's symposium. In addition to our affiliations with community hospitals and other programs in the greater New York region, we're also pleased to have an affiliation, as do all of our members, with two of the leading medical schools in the country, the Weill Cornell Medical College as well as the Columbia University College of Physicians and Surgeons. And we're pleased with our working relationship with both medical schools. One of the true pleasures of the system and the relationship with our members are being able to facilitate programs such as the one you're at today. When Barry Smith, Dr. Smith, first approached me several months ago about holding a symposium on nephrology, talking about some of the policy changes, reimbursement changes, talked about the types of speakers that he wanted to put together and the type of audience that he wanted to gather. Skeptical is probably an overstatement, but I thought Dr. Smith was being a little ambitious in terms of what he was trying to do. And it's a real credit to Barry's leadership as well as the leadership of Rogosin Institute that they've been able to assemble the types of speakers and all of you folks bringing it together to talk about an issue that is very timely, particularly given all of what's going on with healthcare reform and what we're going to be seeing in the coming years. I think it's pretty unique when you look at the composition of today's audience. Normally we'll have a focus where it'll be hospital CEOs, the clinical directors, or nursing staff. But today we have, I think, a really interesting mix of people. We have hospitals represented. We have representatives from the university and the medical schools. We have representatives from pharmacology, from research, practitioners, the National Kidney Foundation, IPRO, the Island Peer Review Organization, freestanding dialysis centers, representatives from venture capital. We should meet those people, and the Organ Donor Network. I think bringing together this audience sort of shows you the types of complexity of the issues that we're dealing with that we'll have plenty of time to address during today's conference. So we're really looking forward to participating with you in today's session, and I think hopefully you'll walk away from this both having a greater appreciation for the complexity, but also a sense of what are the future directions. So with that, let me introduce Dr. Barry Smith. Barry is the director of the Rogosin Institute and a true friend. And Barry, we're happy to work with you.
Well, good morning. I'll just say a little bit about the Rogosin Institute. I think our mission is to provide the best possible health care and quality life for people with kidney disease, as well as those with diabetes, lipid disorders, cardiovascular disorders, and cancer. And we're pleased to be here. The core business, of course, is kidney disease, and the future of nephrology is our subject for today. And just to mention the founder of the Rogosin Institute, Dr. Rubin, who died about 2 years ago, was a visionary, and he's someone who we all regard as a model, and we're anxious to carry this forward. This is, you recognize, one of the first dialysis machines, and times have changed significantly because the holiday punch used to be made in the big steel part of the washing machine. Now, I learned to my chagrin, because I've used this before, the Chinese curse is in fact not a Chinese curse at all. It's attributed either to an Englishman or an American who happened to be in China at the time. And for those who read Chinese, the top line says, "It is better to be a dog in peaceful times than a human being in chaotic times." So I'm not sure how to take that, but that got translated as "may you live in interesting times." And then a very English expression of this from Charles Dickens in 1859, "It was the best of times, it was the worst of times." And I think to a certain extent that's where we are today, with many changes taking place. On the other hand, wonderful science, technology that's developing. So these are things that make our meeting today and the work that I think we all need to be doing very exciting. Now, another Chinese saying, which is I also learned is misused all the time, is crisis. Now, I've always been told, and I know various heads of state have used this and so forth, that crisis had two components, danger and opportunity. But in fact, in Chinese, that's not the case. It's danger plus a critical moment. But I like this because what this means is, I think if we're going to have an opportunity in the kind of crisis of health reform that we face, we're going to have to be the ones, and that means everyone in the room, the range of people that Wayne just mentioned, we're going to have to work together to make the kind of difference that's necessary. It can't all come from Washington or Albany. Some of it's going to have to come from New York, from our individual dialysis units. Wherever we are, I think we have a responsibility to make suggestions, make policy suggestions that can be implemented and tested and so forth. And that's really what we want to start today, is not just to have one meeting and forget about it, but to start a dialogue about how we can make those changes. I think this is an exciting opportunity and one that we can't miss. So what are the broad factors, the things we're going to be talking about today? Providing the best possible patient care. That remains the core. If we're not doing that, we shouldn't be doing what we're doing. We have to look at the workforce. How are we using people to be more effective? How can we put them together to be more effective? Prevention is obviously a major area. We need to get out of our clinics and into the communities, because that's where disease can be stopped and where there can be additional cost savings. And of course, we need to look at the economic sustainability. That's clearly a critical issue. And we know and we'll hear much more about this in just a few minutes, coverage has been increased, but we have to worry, are we making access available? Do people have access? Because if we cover everyone, but you can't get to the doctor or to the nurse practitioner or the nurse or whoever it is, then that isn't very effective either. Now, one point that I like to make, and I think is very important, I don't think, although in our tertiary and quaternary health facilities, health is a thing unto itself, but in fact, I think in a very real sense, health is a product of how well or poorly our society is functioning, who has jobs, who has access to facilities, who has the education to know how to help with their health. So, when you look at a community, this happens to be one that the Rogosin Institute has some involvement in through the foundation that's part of it. Clarksdale, Mississippi is the center of some of the worst health statistics in the United States. And yet there are enormous resources there for improving the health of people with renal disease, with cardiovascular disease, cancer, whatever it is. And I think as we look around us, we need to look at what those resources are in our communities to do more with it. Now again, today, economics, policy, science are the core issues that we want to look at. We have the health workforce, as I mentioned, and I think an often neglected part of the equation is the people themselves. Now, we are the people, we're all patients ultimately too. We need to see how the people can be better integrated into our system. These are things, as you think today, I hope you'll just try to say, wait a minute, maybe we could do this differently. Maybe we could bring the community in. What are the ends? Highest quality of patient care and quality, length of life for patients with renal disease. We want to prevent, as I've already said, as much renal disease or disease progression as possible. I think we need to enable people to be active participants in the achievement of better health. If we don't do that, we're not going to get where we should. Broad universal coverage with strong access, making the system sustainable economically. We need to build this on a foundation of innovative science and sound public policies and economics. And that's why we've brought together the people we've brought together today. And I think we can achieve so much more than we're achieving now if we approach things in a different way. Talking with Dr. Straub, we need a dialogue among all of us, and that's at all levels and categories of the health profession and the community themselves. And kinds of things that we want to think about: establishment of a local and national database, very important, dialogues on the issue and issues on an ongoing basis, broad involvement of people, action. We need incubators for innovation, small pilot and demonstration projects. These are things we'll hear more about. Generation of new policies to promote solutions that work. So we want to put our knowledge to work. And I think what we come up with in the end is, instead of economics, policy, and science being three separate issues, we're going to have them all brought together through the health workforce and the people themselves who are now taking more responsibility for their health. And a key part of that is the electronic health record, the databases we establish, and this morning we're going to hear more about that. I think when you hear some of the talks this morning, you'll hear more about the new analytics of complex multivariable systems, risk management, and bringing that, however, back to the individualized patient's care, which is optimized. So that's sort of just an overview, my thinking about the day. I hope you're as excited as I am to be here, because I think what we're talking about is a process. Partners with the hospital and the other partners of the New York-Presbyterian healthcare system, partners with different parts of the hospital, the Division of Nephrology, the Department of Surgery, bringing these all together. And then all of you, I think, too, are partners in a process to improve healthcare tremendously. We can do that working together.